Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Investigations. So let's dive into the investigations, what need to be done for you to be diagnosed as a PCOS patient. First thing is your LH and FSH ratio. What is LH? LH is nothing but luteinizing hormone and FSH is nothing but follicular stimulating hormone. Remember, LH and FSH should be on proportion like 1:1. But if you are having LHS2 or more than 2 and FSHS1, 2:1 proportion or more than 2:1 proportion, remember it is a sign of PCOS. Then testosterone, free and total. If you have a lot of testosterone increase, then that means you have PCOS. And all of the other tests which are below like TSH, DHEAS, prolactin, all of these tests will help you to diagnose if you have other than PCOS. For example, if you have too much of thyroid stimulating hormone, it can be because of hypothyroidism, which can also cause irregular menstruation. Remember, it's just a symptom. If you are fulfilling PIE category, then that is PCOS. But if you're having TSH increase, then that will cause irregular menstruation, but it can trigger on a longer run PCOS, but starting you will have increased TSH. So if the TSH is increased, it can cause irregular menstruation. If you have androstenedione, which is a precursor for androgens, which is a precursor for testosterone as well as for estrogen. If this is increased, then on a longer run, you will be suffering from PCOS. DHEA. If you have DHEA more, dihydroxyepiandrosterone sulfate more, that means you have adrenal hormonal problem. Adrenal gland also secretes hormones. That problem is DHEA. Increase in that is because of adrenal and not because of your PCOS or your ovarian problem. Same with the prolactin. If you have hyperprolactinemia, it can also cause irregular menstruation. And then if you have this hydroxyprogesterone also, if you have disruption in that also, it might not be PCOS. These are just to diagnose that if you're PCOS or if you're suffering from an adrenal hyperplasia. This hydroprogesterone is caused by adrenal hyperplasia. So either if you're suffering from adrenal hyperplasia or adrenal gland secretions, or if you're really suffering from PCOS, you will be able to diagnose through this investigation. If you get your LH and FSH ratio first and your testosterone, if there is any disruption in this, then maybe you will be directly diagnosed as PCOS. If you're not finding any disruption in both of these tests and you still have irregular period, then go for the other test. Then other investigations which need to be done. First is your blood sugar or your insulin test. Remember, as I already told you, that insulin resistance will cause diabetes on a longer run as well as PCOS on a longer run. Okay, so fasting blood sugar as well as HbA1c, that is almost 3 months of your glucose tolerance, can be tested. Remember, if this both are normal and then you just feel like you might get, or you have a hereditary concept where your mother and father or your primary sibling is suffering from diabetes and you want to know if you are insulin resistant or you're going to a stage of insulin resistance, do the test HOMA-IR, where it will help in diagnosing on a longer run if you will be getting diabetes or not. You can get your HOMA-IR test done, which is homeostatic model assessment of insulin resistance. Through this test, you will be able to know if you're insulin resistant or not, or in the future if you'll be getting diabetes or not. Then lipid profile. Why do you want to know how much is your lipids or what is your lipid level and how is it connected to your PCOS? Remember, dyslipidemia, that is excess of very low density lipoproteins, which is VLDL, and low density lipoproteins can trigger or cause insulin resistance, and then insulin resistance can cause diabetes and PCOS, and then this whole cycle is again running. Okay, and then pelvic ultrasound. As you can see, if you get a pelvic ultrasound, if you can see, there are small dots here. These are follicles which are cystic and these are in a pearl string appearance. If in your ultrasound you are getting a pearl string appearance, which it means that it is polycystic. Okay, so what are the primary tests you need when you want to see if you have PCOS or not? First is pelvic ultrasound, where you have this pearl string appearance of the follicles, first one. Second one, hormonal test, LH and FSH ratio increase. And third one is your hyperandrogen or increased testosterone level. Secondary tests are your diabetes or your glucose test. And third is your lipid test. And then remember that you also need your BMI assessment. If you are having more than 25 body mass index, you are prone to be overweight, you are prone to be insulin resistant. Here at Fidicus, we have two kind of consulting options. One is online consultation and another one is offline consultation. If you are nearby in Manikonda, you can come and here visit us through offline consultation. If you are anywhere around the globe and you've seen this video, you are suffering from PCOS and you want effective cure, then you can consult us online through this number which is visible here, either through WhatsApp or through call. And on online, we have two features, which is audio call and video call. Remember to call or WhatsApp us on this number. And if you're suffering from PCOS and you're not here in India, your medicine will be shipped to you within 5 to 6 days if you're out of India or USA. If you're staying in USA and you like to visit us or you've already taken doctor consultation and you need medication, your medicine will be shipped within 3 to 4 business days. If you're anywhere in India, then it will take about 3 to 4 days for your medicine to reach you. If you're suffering from PCOS, why do you want to choose Fidicus Homeopathy? Here are some reasons. We stand really tall with our highest success rate. The personal care we provide here is of highest quality, and also the medication is transparent. So for safe as well as effective homeopathy, choose Fidicus. Thank you.
Fidicus Homeopathy.